Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967342256, and do contact us for the best OET coaching. For the people who are listening to us on YouTube and want to ask some questions regarding OET, you can always leave a comment in the comment box. We will always reply you, but at the same time, if you want to take the best coaching, you definitely can approach us on the same number, that is 76967342256. So here we are today to start a role play which is very simple otherwise, but some of the OET tasks have not been given in a proper format. Suppose if I talk about this task, it is very incomplete. In exam, you will not get an incomplete task like this. You are delivering breakfast to a patient who is recovering from the minor knee fracture. इसमें एक नोट करने वाली पॉइंट ये है दैट अगर आपका टॉपिक दोपहर को भी हुआ तो आपको गुड मॉर्निंग ही बोलना पड़ेगा क्योंकि यहाँ पे ब्रेकफास्ट दिया है. तो प्लीज अंडरस्टैंड ऑल ऑफ यू, इट इज अकॉर्डिंग टू द टास्क वी विल स्पीक. In normal circumstances you will say good evening, good afternoon as per your timings, but if you are delivering breakfast to a patient you can't say good afternoon, so you have to say good morning, my name is this and I have come here to deliver your breakfast. So you have to take those approaches. So please try and remember all these things which are important. Second thing, the patient asks you when she can be able to go home as he has exam next month. तो आपको बताना है कि don't worry, you are just having a minor knee fracture. अब he will be all right soon. अगर ये exam में आएगा तो आपको बताया होगा that he will be discharged after 1 week. After that, it will take 4 to 6 weeks for complete recovery. But don't worry, you will be able to take your exam, and the examination is not a problem. 4 to 6 weeks are for complete recovery. वो तो हम complete recovery की बात कर रहे हैं कि आप खेल कूद पाओगे, आप चल पाओगे, है ना. तो एग्जाम के टाइम तक ये तो है. आपका एग्जाम नेक्स्ट मंथ ड्यू है. योर एग्जाम इज सपोज टू हैपन आफ्टर अ मंथ. बाय दैट टाइम यू वुड बी एबल टू वॉक, बट विद द हेल्प ऑफ केन. केन होता है वो जो स्टिक होती है ना, हेल्प ऑफ केन या फिर वॉकिंग फ्रेम. आप वो बोल सकते हो कि आप चल पाओगे. केन मत बोलो, विद द हेल्प ऑफ सम सपोर्ट, आप सपोर्ट के साथ चल पाओगे. सो डोंट वरी, यू वुड बी एबल टू टेक द एग्जाम. इंपॉर्टेंस ऑफ टेकिंग मेडिकेशन ऑन टाइम. सी, मेडिकेशंस में पेन किलर्स भी हैं और रिकवरी के लिए आपकी एंटी इन्फ्लेमेटरीज भी हैं और एंटीबायोटिक्स भी हो सकती हैं टू प्रिवेंट इन्फेक्शन. तो जो भी आपको डॉक्टर ने दिया है, प्लीज उन मेडिकेशंस को कंप्लीट करना है और उनको प्रॉपर टाइम पे लेना है. सो प्लीज अंडरस्टैंड दैट यू शुड नॉट बी केयरलेस अबाउट द मेडिकेशंस. बट एट द सेम टाइम, जैसे ये मेरे मुंह से वर्ड निकला केयरलेस, तो ये सब चीजें पेशेंट को नहीं बोलने होते ऐसे वर्ड. प्लीज डोंट बी केयरलेस, उसको उल्टा बोलना है. प्लीज बी केयरफुल अबाउट मेडिकेशन. पॉजिटिव बातें करनी है पेशेंट के साथ. मैंने आपको ये भी बताया दैट यू वुड गेट टाइम 3 minutes टू राइट लाइक दिस. तो ये सब बातें आप अपने क्वेश्चन पेपर पे लिख लोगे. सजेस्ट सम इजी एक्सरसाइजेस. अगर वहां पे इजी एक्सरसाइजेस होंगी तो आपको दिया होगा, जैसे कि स्ट्रेट लेग रेज होता है, थाई स्क्वीज होता है. सो ये सब चीजें आपको वहां पे पेपर में दी होंगी. इफ समथिंग लाइक दिस कम्स इन द एग्जाम, एवरीथिंग विल बी गिवन टू यू एंड यू डोंट हैव टू वरी अबाउट एनीथिंग. सो प्लीज अंडरस्टैंड, अपना फोकस बस अपने टास्क पे रखना है. और अगर ये पेपर के हिसाब से अगर आप सोच रहे हो पेपर में अगर आएगा तो आपको ये सब एक्स्ट्रा पॉइंट्स भी दिए होंगे जो मैंने आपको सुबह भेजे थे. ये मैं आपकी हेल्प करने के लिए नहीं भेज रहा, ये पेपर में आपको दिए होंगे. अगर पेपर में आपके पास टास्क आएगा तो ऐसे दिया होगा, डिस्चार्ज विद इन अ वीक, पॉसिबल इन 4 days एज वेल, कंप्लीट रिकवरी विल टेक 3 to 6 weeks, कैन टेक एग्जाम विच इज ड्यू आफ्टर अ मंथ. ये गलती से मैंने 2 weeks लिखा. Medications are very important because they contain anti-inflammatory, painkillers and many medications which will help you in recovery. There are some easy exercises like straight leg raise and thigh squeezes. फिजियोथेरेपी, अगर एक्सरसाइज के बारे में वो और पूछता है तो कहो फिजियोथेरेपिस्ट विल कम सून. जब भी आपको टॉपिक के बारे में कुछ समझ नहीं आ रहा तो कहो फिजियोथेरेपिस्ट विल कम सून एंड ही विल एक्सप्लेन यू एवरीथिंग अबाउट द एक्सरसाइजेस. अब देखो, मेरे को अगर टास्क करना है मैं आपको बोल के दिखाता हूँ. Good morning, my name is Bhupesh. I am your charge nurse today. So how are you feeling today? Oh well, nurse, kind of all right. Okay, that's good to know that you are feeling all right. But your voice is little shaky. So could you please tell me why are you, like, what is troubling you? Oh well, nurse, you are not understanding that I'm having an exam and I am really kind of worried about my exam which is due next month, and I don't know like whether I would be able to take exam or not. See, first of all, I would like to tell you that there is nothing to worry. If your exam is next month, you definitely would be able to recover enough to take your exam. How about my discharge, nurse? Okay, let me tell you each thing one by one. First of all, I would like to tell you about the discharge, that your discharge is possible within a week or it might be in 4 days. So don't worry, you will be discharged very soon. After discharge, you can go home and you can prepare for your exam. As you have told me, your exam is next month. So you definitely can take your exam next month. By that time, you will start walking, but with the help of some assistance, like maybe you would be requiring some kind of support like walking frame or a cane that doctor will recommend you according to your situation, but you definitely will be able to take your exam. So once you get discharged within a week, after that you can go home and can study well for your exam. Is it okay? Well, that sounds good, nurse. Okay, well, that's great if it is making you happy. And second thing I would like to tell you, the complete recovery will take 3 to 6 weeks. That means after 6 weeks, you will be able to walk freely without any kind of assistance. And also you would be able to do some other activities as well. And with gradual movements, with gradual time, as the time will pass by, you definitely would be able to run as well as you normally used to. As you had a minor knee fracture, so there is nothing to worry, you definitely would be fine. Also I would like to tell you about the, अब examiner की wait मत करो, अपने task को खुद carry करना है. Also I would like to tell you about the importance of medications. So doctor has prescribed you certain medications which consists of painkillers and anti-inflammatories. So please understand, taking these medications will help you in speedy recovery. So please take your medications on time. These medications will speed up your recovery and you would be able to resume your activities quickly. And the last most important thing I would like to tell you about the exercises. Exercises are very important when you are recovering. At this moment, you are not supposed to do any exercise, but after a week, when you will be getting the discharge, you would be allowed to do certain exercises. So please, then you should do some exercise as recommended by the physiotherapist. In early days, after a week, it would be just simple exercises, easy exercises that will not put pressure on your leg or on your knee. It is very important that you should not over pressurize the ligament around the knee, because it is very important for your healing. So whatever the exercises will be recommended to you, do only those exercises. After some time, you will be able to do all the activities, including the vigorous exercises as well, but it will take some time. So till the time physiotherapist does not advise you to do vigorous activities, please do not do it. But nurse, I have so many questions about exercises. Could you please name the exercises? Could you demonstrate the exercises? Well, don't worry. I will also fix your appointment with the physiotherapist. He will come soon and will explain you everything about exercises. So please don't worry. Some exercises would be like straight leg raise and thigh squeeze. So these are kind of the things that you might be requiring, but don't worry. Physiotherapist will definitely be coming soon, as I am fixing your appointment with him, and he will explain you everything about the exercises. Is that okay with you? Well, all right, nurse, that sounds good. Okay, that's good to know that you have understood all the information. And please follow our instructions nicely, because if you will follow the instructions given by us, by your doctor, by the hospital, you definitely would be recovering quickly. Is it okay? Yes, nurse. All right, then take care. I'm leaving for the moment and I'm giving you a leaflet that contains the things about minor knee fracture and its recovery, so you can read all the instructions, and also it has the exercises, what kind of exercises you will need to start. So this is how you speak. अब जैसे मेरे मुंह से गलती से निकला, you definitely will be recover. Recover के साथ कभी भी नहीं लगाना है. बी कभी भी recover के साथ नहीं आएगा. आप में से काफी जनों की आदत है, you will be recover, you can be recover. कभी भी recover के साथ भी नहीं आएगा. You will recover, you should recover, you can recover. Never use be with any of the first form. So this is Dr. Bhupesh from Dr. BKM Institutes, and our contact number is 7696734256. And this is how you execute your role play. Now I will take your doubts, and I am stopping the recording, but I will take your doubts now. Thank you so much. This is Dr. Bhupesh once again, and you can leave the comments for your doubts in the comment box. Thank you.